mean, as far as the plugin goes, what the plugin actually sucks out of Cliniko is only the standardised information.
Yeah.
So it's date of birth, it's the dates that the patient attended for the appointment. The plugin then presents you with a series of questions that have drop-down menus because we need to take standardised data. So no, it's not going to be sucking up your clinic notes and information that you've typed in. It's only going to be extracting very standardised data.
And then digital scores for pain or outcome in some other way.
Exactly. And then it offers you some additional questions, which are just really simple drop-down menus. Currently, it's pain score. One thing we're looking at is what healthcare professionals the patient has seen before they see the osteopath, because that's something we're quite interested in. So there's a little drop-down option there. What their current pain scale is, and then that gets asked every time so that we can obviously see how the pain scale improves through the course of the treatment, what location in the body their symptoms are. So this just standardizes the kind of information you're already taking, but it just makes it in a very easy standardized form. And then what we're also adding onto that is a dashboard. So what this will do is it will present all the data that you've taken using the plugin in a really simple dashboard format, which is going to be great for clinical audit. So it'll say, you know, after you've used it for a couple of months, it'll say, there'll be a nice little pie chart that says this is the breakdown of your patients. You know, 30% had knee pain, 40% had back pain, and then this is the trajectory of their pain scores, the average pain scores over 6 months.
And this is fantastic, isn't it? Because it helps with that irritating objective activity that we have to do in clinic. It's an objective activity done for you. So I want to do a clinical audit, bang, there's your statistics.
Done for you. And
so another great outcome from this.